Okay, today we have three chairpersons. Dr. Petra, I'll just introduce her to you. She's in Dr. Petra is an International Association for Veterinary Homeopathy, Australia. She's currently president of the Austrian Society for Veterinary Homeopathy, served as General Secretary of International Association for Veterinary Homeopathy. She's a coordinator of research section of WIS Home. Welcome, Dr. Petra. Next chair is Dr. Martin Brands. Dr. Martin is a former secretary of the executive board of the GIRI, past president of Homeopaths Without Borders, the Netherlands. And we have also Dr. Ashok Sharma, chief medical officer of Institute of Human Behavior and Allied Sciences. I welcome you all to this session. I'll be calling on the participants. You have 7 minutes to give your presentation, and there'll be 3 minutes for the question answer session. The chairs will ask you questions and you can clarify. Those who have finished their presentation can move on and attend as attendees. So let's start the session. Hope all are. Let's start the session. So the first presenter, I request Dr. Rahul Vardhan. He'll be presenting a case report on rapid, gentle, permanent homeopathy treatment of weeping eczema. Dr. Rahul Vardhan.
Pardon, ma'am. Actually, he's unable to come to the presentation. We'll try to reschedule his slot. Now, ma'am,
Okay.
yes, you can allow the
Next,
next
okay.
presenter.
The next presenter, Dr. Ghauzia Saeed, will be presenting role of anti-miasmatic remedy in case of alopecia areata. Dr. Ghauzia Saeed.
Yes, good evening, ma'am.
Good evening. Yes, please share your poster.
Okay. Madam, is my screen is visible?
No, it is not visible. You share your screen. Yes, it's visible now. Yes. You can start.
Yes, good evening, everyone. Before I start, I would like to show this result, that is alopecia areata. Here you can see your occipital alopecia areata, and after 3 months, you can see there the result is absolutely fine. Where is the occipital region and the right parietal region? You can see within 3 months, it's absolutely fine. Now we'll come to introduce about myself. See, this alopecia areata, because of the such results, the homeopathy is very popular nowadays. It is all over the world. Because of this gaining popularity all over the world, this is a homeopathic medicine is the number one of the science, alternative science, which is popular all over the world because of result like this, which is cannot even able to produce for the modern science of medicine. So I, Dr. Ghauzia Saeed, reader from the Department of the Case Taking and Repertory from the CMP Homeopathic Medical College, plus associated attached to a Sri Mumba Devi Homeopathic Medical College, plus homeopathic physician at NABH Hospital at Mumbai, India. So here I would like to share about my case. It is a very small case. That is a role of anti-miasmatic remedy in case of alopecia areata. Nowadays, alopecia areata is very common. That means it is an excessive loss of hair. Here, the excessive loss of hair, which cannot give only cosmetic concern, but it can also lead to psychological trauma to the patient. Why this is important? Why alopecia is important? Because here alopecia there is alopecia is there. The patient feels there is a lack of confidence and they feel that I don't look good. If you don't feel that you are not looking good, so your personality will shut down and you are not able to concentrate what you are going to present. So here my aim is to study the alopecia in detail, to study the causes of alopecia, to study the pathophysiology of alopecia, and to study the scope and limitation of the alopecia. What do you mean by alopecia? Alopecia means it's excessive loss of hair, which is usually, it's very common nowadays because of the hectic schedules. Different types of alopecias are there, like alopecia areata, alopecia universalis, totalis, areata, trichotillomanitis, and tinea capitis. Usually, this people concerned that what do you mean by alopecia? Alopecia means it's just hair fall, but no, you should be aware that 60 to 100 hair fall in a day is absolutely fine. What are the causes of alopecia? It's very simple. It's first of all, it's hereditary. Hereditary. Any hormonal disturbance, any emotional disturbance, constant worries, trauma, drugs, post-acute illness, like especially after typhoid, having antibiotics, that can lead to alopecia. I'm practicing since last 21 years plus, and I have seen n number of patients with especially in the alopecia because my specialty is especially in the skin and in the hair. So today I am going to present a very small, presentable, sweet case, which here we can make out how the alopecia can treat so easily, so gently, and permanently cure of the disease. So here I'm going to present, this is a small patient, a 6-year-old patient came with the history of complaints of multiple hair patches on the occipital, left occipital, followed by a right occipital, right temporal, right left temporal, and vertex, suffering from the since last 1 year. Okay, and he has taken an increase since last 6 months. He has taken lots of treatment, especially went to a dermatologist, but he has not got any permanent or remarkable improvement. So one of my old patients has referred to me, and I have taken the totality, and I came to know that it's like a simple case like a calcareous force. The patient was thin, with eyelashes, fear of dog, likes traveling, and irritable, sympathetic. So I come to the conclusion that it is a simple case of calcareous force. But here there is a family history of father, he is having alopecia areata in his childhood, and plus mother, she was having a tubercular asthma. So my myasm comes to a tubercular myasm. So here I came to the conclusion, it's very easy that it helps to understand how the anti-miasmatic appropriate medicine can help to cure the miasm when absolutely there is a miasmatic block is there. When you can give an anti-miasmatic role or anti-miasmatic remedy, so the disease which can transfer from one generation to another generation, that can cure completely. The same thing, our famous stalwarts like Dr. Kent has already explained in his lecture of Kent Materia Medica in the tuberculum chapter, that when you will give a calcarea followed by interchange with the tuberculum myasm, or you can give a vice versa, you will get the excellent result for that clinically. It's mentioned in his book, that is page number 951 and 952. Plus here also I can make out not only with the tuberculum, that is it's a nosode, but here we can give a nosode not in the infrequent dose. Here we can give an infrequent dose in the children and we can get a clinically very good result. Here we have another evidence proof like in boric repertory by Dr. William Boric. He has already explained in the tuberculum chapter that in children you can give a what? In frequent doses. So here that approach you can make out that physically and mentally you can treat the patient as a whole. But one more thing I would like to explain, that not only the apart from the medicine, you should give an auxiliary line of treatment, which is very important. Like you can give iron, dates, lots of water intake, and plus I usually tell the patient to apply that some paste like take a 1 full egg, put 1 teaspoon of honey in that, and curd and little bit. And mix it and apply on the scalp and wait for 20 minutes and wash with the normal shampoo. So this shampoo and this thing you are supposed to do once in a week for at least 12 to 16 weeks. So you will get the excellent, very supportive and very happy results. So here you can make out how our constitutional remedy along with the anti-miasmatic remedy can give a permanent cure. Thank you. here I will show this is the data where it's mentioned the anti-miasmatic medicine along with the tuberculin and calcarea phos, you can give both. And here is a William Boric.
Okay, that was a nice and a crisp presentation. I invite Dr. Neeraj Gupta as chair to this session. Dr. Neeraj Gupta, he is a professor of organ of medicine in Nehru Homeopathic Medical College and Hospital. Sir, welcome, sir. Sir, do you have any questions for Dr. Gausia?
Good evening. Gausia has excellently presented this case. I must congratulate, firstly, at this young age and tender age, I would say. She might be a beginner. Anyway, so the point is that alopecia areata, which is having fungal background, so it is reversible in itself. So you have treated the case for 5 months, 5 long months, as I'm seeing from the pictorial presentation. You started your treatment before 30th of November and the end was 11th of March. So these 5 months itself is a long period where it can be reverted back normally, naturally also. So the point is, very well, you have taken calcarea phos on the totality and you have given anti-miasmatic as tuberculinum on the basis of tubercular miasm. But I am seeing that tuberculinum 200, you have given TDS for 7 days. So can you please clarify why tuberculinum 200, which is thought as an intercurrent remedy, and that has to be given for so long, and that is in large doses?
Yes,
Please.
absolutely. Yes, sir. Why not? See, as you are aware that it was just before the COVID, that is a 30th 11 2019. Here I have prescribed calcarea phos followed by the tuberculinum. Here I can give a authentic data because clinically, sir, actually I am practicing since last 21 years. So I have seen n number of cases.
You look so young.
He looks young.
So
I take my words back.
it's a compliment for me. It's a compliment for me.
Please,
So
please.
here, what clinically I have used, I have seen that in the children, if I will give a tuberculinum in repeated dose, I was getting very good results. Not even for the cases or the alopecia, even for the UTI or URTI also. But since I am a reader in a CMP Medical College in Mumbai, where I am teaching repertory. So when I was teaching a repertory in the boric repertory, I came to come to know that conclusion in tuberculinum, in boric repertory, that is on the right hand side, second para, the dose after the second line is mentioned in children. I repeat, in children, though it's a nosose, you can give a frequent doses. Okay, so you can give a clinically good result. So here we have a data. It's an evidence-based data. Clinically, I was aware, but I was not having any data. So you can, shift and you can give both. And since it's a borderline of COVID, since you can see that this picture, I have told the patient, you can just send the pic so I can correlate it. So here it's a clear-cut data that in children, tuberculinum can be given in a frequent dosage. Here also, sir, I have mentioned it's a boric repertory. Okay? In boric repertory, in the tuberculinum miasm, it's a clear-cut statement is there. And plus, what I have said, I will just repeat, our stalwarts that J.T. Ken has also mentioned in his lecture of homeopathic materia medica in tuberculinum. Here also it's there. Okay, after giving calcarea, you can give a small dose of tuberculinum, or it's a vice versa, or interchange. You can give a small amount, you can see the magic results clinically. Though I was not aware before that. But since during a lockdown, I was reading it and seeing the patient. So I got, because of my students also, to come to know it. Oh yeah, this is also at the page number of 951 and 952. So we have evidence-based.
JT Kent, you mentioned that he has mentioned that intercurrents, it has to be given as intercurrent, right? Intercurrents should not be given repeatedly. As our knowledge says, as our understanding of homeopathy says, that intercurrent should be used in a high potency and that too in non-frequent doses. So that is what my contention was.
I understood. But after this, because of the lack of thing, I have increased one dose of 1M also. After 200, because of the limitation here, what PPT I have sent in that I have mentioned, I have shown also that tuberculin 1M was given. Because of the limitation of poster, I have just prescribed only tuberculin 200.
All right. Okay.
Thank you so much. I really, I'm very
Dr.
happy.
Shirin, I would like to know her ID.
Yes, sir. Yes, sir. I will tell you her ID. It is 133 Dr. Gausia Saeed. from
Okay.
India, sir.
Yeah.
Okay,
Thank
sir.
you.
Okay. So the next presenter, I'm calling on Professor Gina Cristina from Colombia. Professor Gina, please come on. Professor Gina.
Good morning for everyone. Greetings for Colombia.
Yes, good morning.
Thank you very much. Can you see my screen?
Yes, please zoom it a little. Yes, that's fine. That's fine. Will you be presenting in English?
Okay, thank you. Maybe there's a little problem with the time. I prefer Spanish if it's possible.
Okay, you can speak in Spanish, and in the end, can you give a short gist about, in a nutshell, so that chair can understand, he can evaluate you. Hello. Hello, Professor Gina.
Okay.
Okay.
Gracias. El sonido lo estamos recibiendo muy tarde en Colombia, con casi 20 segundos de diferencia.
You may go on.
Is there any translator for her?
Sir, actually, they are in the other halls. That is.
Okay.
Okay.
So this will be German for us. Anyway.
Anyway, Professor Gina, you can tell in a nutshell in the end, in English, in 4-5 lines, okay? If possible.
She knows, I think she knows English, so she can conclude in English only. No?
Yeah, yes, that's what I.
Yeah, ask her to speak in English, whatever she has.
Okay, English.
Yeah.
Okay.
Okay.
That will be better, I think.
Okay.
Okay.
No problem.
Good.
Okay, good morning from Colombia. There's a little problem with the sound because we received the words maybe 20 or 30 seconds after you are speaking. This is a case report that we made with a very brilliant student called Diana Paola Spiro Mora. And this is a case that was found in little city in Colombia named Magangue. This is a case of a little baby who was 6 months old, and he had Janowicz-Crosty syndrome. The case consisted in a clinical statement due for about little small eczema lesions that he was after a bronchiolitis clinical case, maybe 2 or 3 weeks before. And then the child presented little eczema localized in her neck, her shoulder, her chest, and the legs. The child was treated with common corticosteroids and he doesn't that he doesn't a better state, and he present a enormous stretching state, and his mom needed the homeopathic consult. This is a syndrome that is produced by several viruses like Epstein-Barr virus, Hepatitis virus, maybe for say megalovirus too. Let me check you. This is the initial lesions. These lesions doesn't respond to corticosteroids and emollients creams, and we take the symptoms and we use the repertory of radar repertory, and we obtain the principal medicine that was sulfur. We prefer in Colombia, we use a lot the LM scale, and we use the O6 potency, and the child received 2 drops plus 7 spoons of water, and he took 1 little spoon each 4 hours for 2 days, and then each 8 hours for 1 week. What was the results? We can see better evolution after 28 hours. The stretch was diminished a lot, and the lesions too. We conclude that this is a benign disease of the childhood, and it's an expression of a SORA. But in some cases, it's possible that the Janoti-Crosty syndrome could be an expression of the psychosis mians. And we conclude that homeopathy is able to help to get better in these cases in a few hours, because this syndrome is able to resolve by itself in a place or in a time of 2 weeks and from 1 year. And in this case, we obtain a better condition in 48 hours and a total recovery until 10 days.
Okay, ma'am, sir. Any
Has
questions?
she finished?
Yes, sir. Yes, sir.
Okay. Firstly, I would like to say that Dr. Geena has taken up the case, which is very similar to her name, Gianotti-Crosty syndrome. So I was not aware of this earlier, but now I came to know that this has been wonderfully cured, wonderfully taken up by you, with sulfur as one of the antimiasmatic and one of the chief antisoric remedy. So it is good effort that you have put in, and to my understanding that can you please explain that this case was a pediatric case? Is that so, Dr. Geena? I mean, was it a child?
Yes.
What was the age of the child?
I think she said 6 months.
6 months, okay. So there was in the air that this kind of syndrome was prevalent or comorbid with COVID-19 also, because COVID-19 was also associated with some kind of allergic reactions and some kind of association with these kind of skin disorders. So is this case associated with that? I couldn't get it actually initially. Dr. Geena, was it related with COVID-19 somewhere?
Dr. Gina,
Sorry, I'm hearing two or three voices and it's impossible for me to understand.
Okay. My question is that we understood that COVID-19, when you were taking this case, you were telling something to do with COVID-19. So we understand that COVID-19 would give certain kind of allergic reactions on the skin. So was this case associated with COVID-19 in any way? Have you understood the question?
Hello, Gina?
Hello,
hear me?
sorry. I have a sound return and I hear my voice at the same time with
Yes.
your voices and
It's
it's
okay. It's
impossible
okay.
to
No
understand.
problem. No problem. Anyway, wonderful presentation. Whatever. Good. Nice. Dr. Shirin, can we know the abstract
Yes.
ID for Dr.
ID for Gina's extract ID is 102, sir.
Okay. Thank you.
Okay, thank you, Professor Gina.
Thank you very much.
Like, it was nice to hear you in English. Okay, the next presenter is Dr. Rahul Vardhan. He's here. Dr. Rahul Vardhan, abstract ID is 103. Dr. Rahul,
Good evening, ma'am.
good evening. Yeah, that's fine. That's fine.
Thank you, ma'am. Good evening, everyone. I'm presenting a case report on rapid, gentle, permanent homeopathy treatment of weeping eczema in a 5-year boy on face. As why this case is important for us, this because this teaches us that we frequently encounter questions from our patients, from their parents, that how frequently, how fast can we treat any condition in homeopathy. They want quick treatment from us, and that's why this case is very important to present in this type of in homeopathic fraternity. As you can see in the picture one, this is a case of weeping eczema. The child was the face on right side of the face. There was eczema, and it was discharging, and it was moist and itchy, and all types of problems related to eczema were there. But despite taking best allopathic treatment from best allopathic hospitals in Delhi, for more than a year, there were not much improvement. But after detailed case taking and detailed history taking of the child, the proper selection of the rubrics were done, and within a with single dose of indicated remedy, as that we will see in the repertorization chart, within 3 days, as you can see in the second picture, the there was complete dryness of the eruptions. That is quite evident in the second picture. And
Dr. Rahul, can you please zoom in this picture? I mean, the whole of your presentation.
yes, sir.
Yeah, please. Because the font size seems very small. Yeah, it's better. It's better. Yeah.
So in this case, a detailed case taking was done to identify the peculiar characteristics of the case, behavior of the child, and how the behavior is affected by the sufferings of the weeping eczema. Then suitable rubrics were selected to repertorize the case, and a single dose of homeopathic medicine was administered. The first follow-up was done after 3 days, and subsequently every week follow-up was maintained. The patient, the child was suffering from eruptions, eczematous on face, scalp with itching, discharging moist with no major time or weather modality. He was also suffering from recurrent cold and coughs. The child was becoming restless, annoying to others. And one significant change that was noticed in his behavior was he started cutting curtains, bedsheet with scissors. It was getting difficult for the parents to control the child. No significant medical or family history of the similar disease was found. The repertorization was done as the chart given below. The following rubrics were taken up, like anger in children, destructiveness, restless nervous children in eruptions, eczema, moist, and food and drinks, milk, desire. And the indicated remedy that was coming up was quite clearly tuberculinum. And tuberculinum 200 single dose was given for initially for 3 days, and in the second, as you can see in the second picture, the eruptions totally became dry only on the third day. This is the most significant part because we often in eczema cases we often find that patients do improve, but they take quite a long time. But in this case, when the indicated correct remedy was given, the result was shown within 3 days, despite patient taking allopathic treatment for more than 1 year. And in next third picture, as you can see in the third picture, the follow-up was done after 7 days. The eruptions were almost disappearing. And in 3 weeks time, the eruptions were totally gone, and they were followed up for almost 2 months later, and there were no recurrence also. The primary takeaway from this case that homeopathy can cure rapidly, and even homeopathy and every homeopathic physician can take a note that if there is a case is not responding quickly, then we need to reevaluate our case fast. The report is very important as it reaffirms the place of classical constitutional single dose homeopathic treatment in quick treatment of weeping eczema. Thank you, sir.
Well done, Dr. Rahul. This case definitely gave a concept that homeopathy is wonderful in these kind of cases. And the takeaway message is that if you happen to select the remedy on the basis of the totality, constitutional, whatever, so this has really helped the child. And above all, what you mentioned was that there was no local application which was allowed, which was applied. So this is one of the nice things that you have mentioned, and I congratulate you for your wonderful presentation. Thank you. There's no more question.
Thank you. So that was Dr. Rahul Vardhan, sir, 103, abstract ID. The next ID is 215, Dr. Kavita Sharma. Dr. Kavita Sharma, she'll be presenting individualization as an approach for treatment of alopecia areata. Dr. Kavita, please.
Good evening. Good evening, everyone. Greetings to all. And I'm going to share my screen. The title of my poster is Individualization as an Approach for Treatment of Alopecia areata. Alopecia areata is an autoimmune disease for which patients frequently seek homeopathic treatment at primary health centers. And today I'm going to share a case of 23-year-old Indian unmarried female who presented with loss of hair in circumscribed patches, with loss of eyebrows and eyelashes in December 2018, as shown in this picture. Her complaint started in October 2015 with patchy hair loss, which gradually increased in severity. There was no spontaneous remission and also no improvement from various modalities of treatment undertaken within last 3 years of onset of disease. Just a minute. I'll reshare my screen.
It is already shared. The repertory chart is shared, Dr. Kavita. Dr. Kavita, you have shared the repertory chart.
Yes, I'm going to share my poster.
Okay.
No, it's not coming.
I think you
It's
can
not coming.
close this window and
I'm just trying to reopen.
Can technical team share the poster of ma'am?
Yeah, sure, ma'am.
Yes. Ma'am, the technical team will present your poster and then you can speak.
Just a minute, I'm sharing. I've shared now. I've shared now. I hope it is visible now.
no, Dr. Kavita, it's still the repertory sheet. It's still the repertory sheet on screen.
Now is it visible?
Ah, yes, now it's come. Please zoom it a little.
मैम टेक्निकल टीम ने शेयर की है इनकी सीवी वो पोस्टर.
Okay, Dr. Kavita, your poster is.
Okay, Dr. Shireen. Yeah,
Okay.
right.
You can go on.
So back to the case. Her complaint started in October 2015 with patchy hair loss, which gradually increased in severity. There was no spontaneous remission and also no improvement from various modalities of treatment undertaken within last 3 years of onset of disease. Her father's sudden demise in June 2018 due to myocardial infarction caused massive emotional shock, and thereafter she was in severe depression. Her father was a practicing CA, and sudden death of her father really affected her deeply, as apart from emotional attachment with her father, she used to get regular guidance from him in the studies as she was pursuing CA. Thereafter, her hair loss worsened, involving eyebrows, eyelashes, and 80% of the scalp. After her father's death, she became very sad, irritable, quiet, kept brooding on her loss. Her sleep was disturbed, appetite was reduced, and she is sensitive to odors. Odors of certain kinds of foods and perfumes used to hit her hard. There was hard stool. She used to skip a day often. She was chilly and thirstless. Progressive hair loss caused great stress, and she became a recluse and stopped going out or interacting with people. She was using a wig as she thought people would laugh at her. As I could gather from her history, she's been an intelligent girl, ambivert, always been very good in studies, diligent and responsible. The totality of symptoms, including constitution, journals, and pathology, were taken into account. The case was analyzed and repertorized from synthesis laboratory. The rubrics considered were mind brooding disposition, mind irritability, worse consolation, mind sadness with taciturn, mind sensitive to odors, and head hair falling in spots. The remedies that were considered after repertorization were ignitia, lycopodium, sepia, nitramur, arsenic album, and calcarea Ka. Among these, ignitia amara was selected on the basis of brooding disposition, irritability, worse consolation, sadness, taciturnity, sensitivity to odors, and the patient being chilly and thirstless. Ignitia 200C, followed by Saclec, was prescribed on 3rd December 2018. Now on, she was not on any other medication apart from homeopathy. Patient was followed up after 15 days, though there was no obvious change in the patches, but there was improvement in her general state. Appetite was better, and the sleep got better. Result, the regrowth of hair started in the patches within 2 months and improvement was seen with each month during follow-up. In between, Ignitia 1M was given after 3 weeks and also repeated after 4 months. Gradual and complete recovery was seen along with improvement in general state of the patient over the observational period of 18 months, as can be well seen in the pictures here, if the pictures could be enlarged. Since many a times relapses are seen in alopecia areata patients, the patients was followed up for a period of 30 months and no sign of relapse was seen during this duration. This case presented with a good clinical outcome and her hair grew to a good length, thick and lustrous as depicted in the last picture. More so, her confidence increased. She became outgoing and successful in her endeavors. Here I conclude that the above case suggests that individualization is a key factor in treatment of autoimmune diseases such as alopecia areata. Alopecia areata is an autoimmune disease of hair follicles where inflammatory cells attack the hair follicles in the anagen phase and therefore the hair follicles do not mature, rather they prematurely enter the catagen phase. Ignitia amara was found to be effective in regeneration of hair follicles and complete recovery was seen in the above long-standing case of alopecia areata when prescribed as per totality of symptoms. The purpose of this presentation is to document this case with good clinical outcome as it can further widen our insight into suitable application of individualized medicines and help in repeating cures. However, as this is a single case study, role of individualized homeopathic medicines in case of alopecia areata requires further research. My sincere thanks to Dr. Rajkumar Manchanda, Director Ayush, for academic guidance. And I also acknowledge support of Dr. Rashmi Nagpal Arora in presenting this case. Thank you.
Thank you, Dr. Kavita, sir.
Yeah. Nice presentation, Dr. Kavita, and nice case. But I would like to ask you that alopecia areata being the fungal autoimmune disorder, basically. So you have followed up for 18 months, possibly 1.5 years, a very long follow-up, and the result had been very, positive. My question is, did you consider the relationship of remedies, because you have prescribed Ignitia as the first remedy, and intermittently you have used higher and higher potencies also. You started with 200, then 1M, then you had possibly given other remedies also. You did mention about other remedies also, calcarea and arsenic. I don't know, you have spoken of. So what was your consideration of taking these remedies one by one? Why these were prescribed when you had the totality in front of you, you repertorized? So what was your criteria of changing the remedies frequently? Please tell me.
Sir, the medicine was not changed. She was given Ignitia 202 doses on 3rd December. Thereafter, it was repeated after 3 weeks. And one dose was given in April 19. Only 3 doses were given. Rest of the medicines, they came in the repertorization.
No,
While
that's true.
repertorizing, those remedies came and they were ruled out. Like natrum is hot and thirsty. And there is no sensitivity to odors. The sensitivity to odors was the eliminating symptom, the symptom I entered the case, and along with that, the state of the patient at that time, the patient was in grief. She was not able to come in terms with the sudden loss of her father, and she was chilly, thirstless, and these were the symptoms. And once Ignitia was given, I could see in the next follow-up only, because she was not able to sleep, there was a lot of emotional turmoil going on, and I couldn't find the difference in the general state of the patient. There was some improvement in her appetite also. So since the patient was improving all the way on Ignitia, and wherever I found there was a need, there was a standstill, therein the remedy was repeated, but only 3 doses have been given in the whole case. And since the patient was consistently improving, and as it can be well seen, by the time of 10 months, there was a good growth of hair. But the patient's alopecia is a state wherein there can be spontaneous remission also. So she was under observation for 18 months. And then there was a COVID period. There was a hiatus of like 1.5 years, but still the patient is still in follow-up with me. She comes over for her small URI complaints or small issues.
But I think you did mention about other remedies also in between.
Sir, those remedies were in the repertory sheet.
No.
After repertorizing,
my idea of asking you is, did you consider the relationships?
Sir, I did consider, I thought of changing, but the only point where I could not change was कि since the patient was, this is why I am presenting this case also, because since natrum is chronic of ignitia, we could have considered natrum also. But the patient, I could see improvement in with ignitia. Like I said, her sensitivity to odors,
No,
the
that's
state
okay.
at that point
Yeah.
made me to enter through ignitia. And once I could see improvement with ignitia, like after 3-4 weeks, we could see the change in the character of the scalp of the skin. It looked more supple, and gradually we could see small hair follicles also. The patient was maintained on this remedy only, and we could cure the case with ignitia itself.
Nice. Thank you.
Okay, thank you, Dr. Kavita. So that was Dr. Kavita Sharma. Next is Dr. Sapna Gupta. So her abstract ID is 281. Dr. Sapna Gupta, she will be presenting treatment of severe psoriasis by individualized homeopathic approach, evidence-based case reports. Dr. Sapna?
Yes, sir. Yes, ma'am. Am I audible, ma'am?
Yes.
Okay, good evening, ma'am and sir and everyone. I'm presenting the poster on treatment of severe psoriasis by individualized homeopathic approach. This is evidence-based 2 case reports of severe psoriasis. So as we all know that psoriasis is a chronic immune-mediated multi-system disorder, chiefly affecting the skin, nails, and joints. And it has a typical course of remission and relapses. And as per the PASI, the Psoriasis Area and Severity Index score is one of the gold standard which is used worldwide to measure the severity and to measure the response of treatment. The PASI score was calculated for both the patients before and during the treatment, and photographic evidences were also collected. Now, as per the criteria and classification of psoriasis into mild, moderate, and severe, usually combination of 2 scales is used, PASI score and life dermatology, life quality index. So for mild psoriasis, both of them need to be less than 7. If they're between 7 to 15, it is moderate. But if PASI score is above 15, it is taken to be an independent criteria to classify the patient as severe psoriasis. So both these patients had PASI score above 15. One had 38.8 and another had 25. And in conventional therapy, for severe psoriasis, their patients are given oral corticosteroids and methotrexate, cyclosporin, and biologics, which are basically immunosuppressant treatment, and they have widespread side effects on the body, ranging from GIT disturbances to neurotoxicity, nephrotoxicity, hepatotoxicity, and several others. So 2 cases of severe psoriasis showed significant decline of PASI score with individualized homeopathic treatment. Now, for both the cases, a detailed case taking was done and selection was made as per the homeopathic prescription principles, and repertorization was done from synthesis repertory, and PASI score was measured, and photographs were also taken for the patient. Now, for the case 1, this is a case of a 40-year-old woman.
Dr. Sapna, please share your poster.
Sir, ma'am, is it not shared?
It is not visible on screen.
No, it is being visible.
It is
It is there.
visible, ma'am.
Yes.
Okay. Is it visible, ma'am?
Yes.
Okay. So a 40-year-old woman, she presented with complaint of psoriasis since 2.5 years, and the eruptions were generalized all over the body. And she complained of cracks and severely itchy, and there were a lot of pain and burning in the skin eruptions, which was worse after bathing. In her past history, she suffered from paralytic weakness of right half of the body, for which she was given, which was treated with vitamin B12 injection. Patient was found to be, in her thermal reaction was chilly. She had a changeable appetite, bland taste in mouth, and she complained of backache before menses, which improved with the flow. Now, on inquiry into her mental state and circumstances, it was found that she could not conceive for a long time after her marriage, and once she conceived, it got aborted. And this woman raised the child of her husband's son for 3 years, like her own child. The child lived with her, and but his biological father eventually took him away from her, and this gave her a sense of deep grief. And eventually she did conceive, and today she has 2 children. But when telling the story, she felt that even today she's very attached to the child, and she feels very sad that he is not with her. And her husband had come, and when I asked about her nature, her husband said that she is very helpful. She will go to the neighbors, and if anyone has any problem, she would reach out and help herself. So with these symptoms in mind, the first prescription we gave her was causticum 30 3 times a day for 3 days, followed by placebo for 15 days, sorry. And causticum was given on the basis of a history of deep grief and sympathetic nature. There was a right side paralysis also, there was history. And when we refer eruptions burning in synthesis repertory, it is in 3+, and skin cracks also, causticum is given in 2+. When the patient came after 15 days, she had no improvement, and by that time her complaint had increased even further. She had extreme pain, and she said, I cannot even wear any cloth on it. There is so much pain from touch. So on this acute illness, acute state of the condition, I prescribed her Hepersul 30 3 times a day for 7 days. But after 1 week when she visited, again, there was no relief. Now next,
you are running short of time, Dr. Sapna. You are running short of time, please.
Okay, sir. Okay, sir. So next time when she came, I gave her sulfur 31 dose on the basis that she had a lot of burning, worse bathing and scratching, and also when the well-selected remedies failed to act. Now with sulfur 31 dose, she continued to improve for next 3 months. On 4 months, she was on placebo. Again, there was a relapse, and the case was freshly taken and repertorized, in which phosphorus gained the maximum marks, and it covered all the rubrics. Also, we referred to Herring guiding symptom, wherein phosphorus is mentioned as psoriasis on knees, elbows, legs, and eyebrows. Phosphorus 30 TDS 3 days was prescribed at 5th month, and she improved. So she kept on improving, and after 2 months again, phosphorus 30 was given. There was a relapse at 9th month, but the relapse was not that severe as before, and for sulfur 200 was given in 9th month, 11th month, and 18th month of treatment. So her PASI score reduced from 25 to 11.1 at 6th month, and finally to 4.8 at 20th month. Now, the second case was a 36-year-old male who had psoriasis all over the body and since 1 year, and he complained of severe itching and stiffness, which was worse exposure to sun. He had a history of a habit of tobacco chewing. He was chilly, perspiration was scanty, and he was very irritable, and he was very much disturbed.
Your time has shown that it has been over now. Can you please quickly wrap up this case?
Yes, sir. So in the second case, we found that the PASI score reduced from 38.8 to 8.8 in 6 months and to 0. So as per accepted guideline, improvement of PASI more than 75% is accepted as a accepted as a target for any treatment. So in both the cases, we had PASI more than 75, and photographic changes were also observed, and the relapses which happened were much less in intensity, and they could be controlled. So we do say that psoriasis can offer a cost-effective, safe treatment, and maybe long-term therapy studies, for longer duration can be conducted to assess the true role of homeopathic treatment. I'm done, sir.
Yeah, Dr. Sapna, congratulations that you have been able to bring the outcome very nicely. Evidence PASI score, which has been a very scientific tool which we can use for assessing the outcome. So the first case you have elaborated a lot, and I could see in between the lines that you had given sulfur as one of the remedy in 30 and 200. So it gives us an idea that we have to consider whenever the cases get stop, when the improvement stops. So we have to use intercurrent anti-psoriatic remedies. So that gives us an idea that we can use and we have to use something in between that to take the case up to the end. It's nice. Anyway, that's all. Thank you.
Thank you, sir. Thank you so much, sir.
Thank you, Dr. Sapna. The next is Dr. Rajiv Nair. His ABS ID is 297, sir. 297. Topic is homeopathic intervention in chemotherapy, extravasation induced chronic non-healing ulcer, a case report. Dr. Rajiv.
Yeah, ma'am, I'm there. Yeah. I'm just joining in. Actually, I'm extremely sorry. I'm simultaneously conducting a PG examination also. So in between, I just came for this presentation. Warm good afternoon to all the respected dignitaries and other panelists. Today, I will be presenting a case of chemotherapy extravasation induced chronic non-healing ulcer. And this is a case in a female aged around 47 years old. And I should not reveal the finer details, but she happened to be the mother of one of our students. And this regarding a brief introduction to the extravasation. This extravasation refers to leakage of injected drugs from blood vessels caused by damage to the surrounding tissues. Common symptoms and signs of extravasation include pain, stinging, or burning sensations, and edema around the intravenous injection site. In severe cases, extravasation may cause tissue dysfunction or physical defects. In terms of cancer therapy, extravasation refers to the inadvertent pre-infiltration of chemotherapeutic drugs in the tissue surrounding the IV site. Now, as many of us are aware now, majority of the times when the chemotherapy sessions are going on, they actually go for the main venous intervention. But since the patient develops some certain complications post the main intervention, IV route was opted, and post IV all these things happen. And this extravasated drugs are basically classified into based according to their potential for causing damage as a vesicant, irritant, or a non-vesicant type of drug. And vesicant being further classified as a DNA binding or a non-DNA binding. The incidence of extravasation, to be very frank, the frequency of extravasation in adults is reported to be 0.1% to 6%. And based on the extravasation assessment tool, this case belongs to grade 3. And I'm just having a brief introduction to what is that non-healing ulcer. Now, this chronic non-healing ulcer is often associated with floor containing unhealthy granulation tissues and slough with a serosanguinous or purulent bloody discharge. Regional draining lymph nodes may be enlarged, but majority of the times it's non-tender. And this case report depicts an adult age female 47 suffering from a metastatic carcinoma of the right breast and undergoing chemotherapy and later on radiotherapy as well, and who developed an extravasation injury due to iatrogenic cause. And it was on the left hand at the site of insertion of a cannula for chemotherapy. This led to an ulcer in the course of few weeks. And non-responding to the conventional line of treatment, now it developed into a grade 3 ulcer. And the patient was advised a surgical intervention, which she declined. And she instead opted to, have homeopathy because she did not want to have any more pain, or she did not get subject to any more pain now. And this is the time when actually her child brought all her reports, and for the first time I was consulted. And in the initial phases, now based on the data which I had, at least from the clinical data I had, Carnibike 30 with SL for 1 week or almost 10 days was given to the patient. And one of the main indications for which this particular remedy was given was basically because this particular ulcer had developed punched out margins with severe pain and restricted movement. And as already mentioned, in chronic non-healing ulcers, we have discharge now, which was characteristic of Kali bike. It had a thick yellowish green discharge. And taking into consideration the syphilitic domain or miasm in the background, and especially CA with metastasis, Kali bike, and as to be very frank, I did not want to have a repeat of the Ken's observation, the first observation wherein killer aggravation happens, and especially in such cases, in pathological cases where deep acting chronic constitutional remedy is given in high potency. So I did not want to do that. So if you see now, Kali bike 13 minimum dose was tried in this particular case, and since this particular patient was actually undergoing a lot of chemotherapy during the same simultaneously. In the later sequelae, in the subsequent follow-ups and all, especially when on 9/1/2018, when she was brought to me, there was no any form of change in this particular patient. And taking into consideration, the pathology, Kali bike 0/1 was prescribed on the 1st of Jan 2018, and taking into consideration that the patient is undergoing chemotherapy and frequent repetitions are needed, and to prevent any untoward aggravation, 0/1 was prescribed. And in it subsequently in due course now with 0/1, and it was given on repeated basis. Subsequently in due course with SL intermittently, she showed marked improvement in the discharge. The discharge reduced, and frankly speaking, this being a school teacher now, she caused a lot of restriction in her daily activities, and she had to do a lot of board work, and simultaneously do other works pertaining to the hand. So there was a lot of restriction on her movements. So with Kali bike 0/1, she showed marked improvement. At least the discharge reduced, and the pain also improved. And then the most important part was healthy granulation was seen in the base. When in between the chemotherapy cycles were being continued, we did not intervene with it. And post chemotherapy, many times she used to report to us. 2018, she came again to me. The same medicine was repeated, and there was further healing in the ulcer now. And 25/4/18, again after a few sessions of chemotherapy, the discharge and size reduced, but the patient developed oral ulcers with fullness of the abdomen, disturbed sleep, severe body ache, cramps. Meanwhile, chemotherapy cycles were completed and radiotherapy sessions were going on from 4/4/18. Hence, at this juncture, radiobrom BD was prescribed and as a phase remedy based on the indications of severe aching pains, ulcers taking a long time to heal. And in due course of time, on 2nd of May 2015, the ulcers reduced in size and patient improved significantly. The same medicine was repeated, and with profound improvement in the ulcer. Ultimately, on 16/5, the patient improved drastically, and this was the phase now since the patient was undergoing a lot of radiotherapy. She was actually she developed a lot of sleeping problems and with a lot of cramps and all. Calcarea Phos 6x was prescribed 4 tabs TDS for 2 weeks. And in month of June, the ulcer healed completely, and patient is still under treatment for the other severe small trivial issues. And I'd like to conclude, in spite of the patient undergoing so much medications and radiotherapy sessions, homeopathy was able to come to the rescue of the patient without any surgical intervention. The ulcer healed, again pointing out the efficacy of homeopathy even in such pathological cases. And I thank all of you for your patient listening. And if any queries to be clarified, I'm there. Thank you very much.
Yeah, thank you, Rajiv, for your honestly putting up the case. I could feel the number of medicines which you have given. They seem to be appropriate at one or the other time. And Burnett and Hahnemann has also said that in chronic diseases and in one-sided diseases, not single remedy may be of help. You need to have cluster of remedies, and you have very wonderfully given these remedies one by one, depending upon the state of the patient. And I congratulate you for this wonderful presentation. Thank
Sir.
you.
Thank you very much, sir. Thank you, sir.
Thank you.
Highly appreciate it. Thanks a lot.
So the next presenter is Ms. Avi Hung. She's from China and her abstract ID is 429. Ms. Avi Hung. She'll be presenting the topic, an eczema case of a middle-aged male hairdresser using individualized homeopathy treatment.
Dr. Shirin, can you please repeat her ID, abstract ID?
429.
429, okay.
Yes. Ms. Avi. Hello, Ms. Avi.
Sorry, I haven't unmuted myself. Sorry. You hear me okay?
Yes.
All right, thank you. You guys see myself? Oh, I have to start my video. Sorry. All right, so let me start now. Hello, everyone. I'm Avi from the Hong Kong Association of Homeopathy. Today, I'm going to present to you a case of a middle-aged man who has suffered from eczema for over 20 years and how by using individualized homeopathy treatment, he has now fully recovered. So let me give you a slight background about this patient. This patient is 54 years old, Chinese male. He is a professional hairdresser and some of Hong Kong's celebrities are also his customers. So before he used homeopathy, he uses steroids mostly on his eczema outbreak. So with the prolonged use of steroids, he has developed high blood pressure and he's also become a borderline diabetic. So let me show you the pictures when he first came to us. So you see from these figures, figure 1 is the eczema outbreak on the patient's face. You see is red and the skin is scratched and everything like that. And figure 2 and 3 are the eczema outbreak on the patient's arms and legs. Do you recall anything? Do they look like the skin of a palm tree? So this is exactly what he was feeling. So whenever he feels itchy, he will start to scratch himself. And by scratching himself, his skin will fall off. So remember I told you he was a professional hairdresser? Imagine when you were having a haircut and his skin starts to fall on you. So this is how irritated he gets. So he came to us and we done a thorough consultation with him and we identified the following unique points that are very unique to him. First of all, he says, I use eczema as a weapon. This patient treasured a lot about his personal space. He will use eczema as a weapon to guard his personal space. What do I mean by that? Let me give you an example. Whenever he's on the public transport, he's easily feel intruded. So he would scratch himself and would leave crumbs on the seat so then people will be scared off. He's also a very impulsive person. He gets easily offended, and then there were once that he almost beat a person to death on the public transit. Although he was very impulsive, he would only stand up to people who was weaker than him. If this person was 6 foot tall and muscular, he would suppress his anger and retreat. But if the person appeared easily taken down, he would definitely fight back. The patient also enjoys making fun of people ever since he was a child. He loved to tease his classmates, and he would throw dusters around. He would slap his classmate who was standing outside the classroom, and many more. So after identifying his peculiar points, we put these into the repertory. So for his mischievous acts, you see we select these 2 rubrics. 1, mind teasing behavior. Secondly, mind teasing. So these 2 rubrics are basically the same, so we combine them together. And remember I mentioned above that he suffered from hypertension, so we select these 2 rubrics, which is general hypertension, clinical hypertension, high blood pressure. And again, they are the same, so then we combine them together. From his consultation, we also noticed that he is an easily envied person. So we also select this rubric, mind envy. And last of all, his symptoms will be worsened when the weather is warm and wet. So this rubric is also coming into place. So general, weather, warm weather, wet, aggravation. So you see from the analysis, Arania isobola stands out from the result. So we further verified this remedy by taking reference with the Materia Medica. So this is the quote from Nadita Shea. They are restless and have poor impulse control. They can be deceitful. After doing something wrong, they can act charmingly and win you over. So this is the spider remedy that we have prescribed. Okay. But because of this, due to the severity of his skin problem, we start with a lower potency. So Arania isovola 30C was prescribed. So treatment started in June 2012, sorry. I want to point out that for eczema patients, aggravation of symptoms in the initial stage of recovery is inevitable. So in the first 2 months of the prescription, the skin was red and itchy, and his entire body was edemous. And he also felt chilly even in midsummer time. Just let me show you the pictures when he was undergoing the aggravation. So figure 6 and 7, you will see that the aggravation in the first 2 months after prescription. You see that the lower body was edemous, is red, and the skin is itchy, and it's like that. But the good thing is, the chilliness is gone within 2 weeks, and the edema was reduced rapidly. And 6 months into the first prescription, pain in the sciatic nerve, which is an old symptom of this patient, also resurfaced, and small boils developed over the bodies and the joints. These symptoms disappeared within a month, and more healthy new skin appeared. And towards the end of the treatment, this patient developed a fever. This fever only lasts for 1 day, but after this fever, this patient has a drastic change. The pain and boil disappeared along with the fever. Itchiness and painfulness on the skin appeared just mildly and soon vanished. The patient also reported that he found himself much less impulsive. So according to the Monarch criteria for homeopathy, this case had a score of 12 out of 13. As this is a chronic case and the score is above 8, this case is considered to be indicative of a good causality score. So let me conclude. Eczema is an ever-growing illness in Hong Kong. According to the statistic from the Hong Kong Allergy Association, there is 1 in every 5 individuals who suffer from different severity level of eczema. When homeopathy treatment begins, although an aggravation of eczema is inevitable, it is indeed curable. It is very important that the patient well understand the aggravation of the symptom is a part of the recovery process. And just to say that homeopath will walk hand in hand with the patient throughout the recovery process and be there until the patient has fully recovered. So this is my sharing. Thank you for your time.
Thank you so much, sir.
Yes, Dr. Avi, I congratulate you for your wonderful presentation, and that too in before times, few seconds before time. Yeah, it was nice to see your case. Arania exabola, spider remedy, you have taken out very good rubrics out of it and repertorized, and you had given 30C, right? And possibly you had increased to 200.
Sorry, would you mind just speaking just a little louder? Sorry.
Yeah. Are you able to listen me? Now?
Yeah, it's okay.
Okay. So you had given Arania exabola 30, and then you raised to 200, right?
Yeah.
Is that right? And did you at any point of time needed any intercurrent anti-miasmatic remedy? Did you think of any anti-miasmatic remedy?
Sorry, could you repeat the last part?
Yeah. During the course of the treatment where you had given Arania exabola 30 or 200, did you feel the need of giving any intercurrent anti-miasmatic or anti-psoric remedy?
Oh, you mean do I need an extra remedy to on top of the Arania exabola? Is that right?
Yeah.
I think during the course of treatment, we focus on one remedy because it's better to monitor the patient's reaction to that remedy, and we can better monitor the recovery process, whether it follows the Herring's law, whether he was really because remember he was suffering from high blood pressure, and he's also suffering from a borderline diabetic, and he's also suffering from eczema. So by applying with only one remedy, we can really track his recovery process, whether it is from the inner, first the inner recovers, and then the outer, and then the outer. So whenever the inner symptoms starts to recover, so whenever his blood pressure starts to lower and his diabetic score starts to lower, his eczema starts to worsen. So you see from the picture above that I showed you before that he's all swollen and he's very red and itchy. And then after the the high blood pressure lowered, and then his eczema starts to get worsened. And then when we start to apply another set of remedy, then the same remedy, but then another dose, then the eczema starts to recover itself as well. So we haven't applied another remedy along throughout the treatment. We have only stick with Irene as well.
Did you cater for some other remedies for controlling his diabetes and hypertension? Was he on any conventional treatment for that?
Oh, he hasn't come into any conventional treatment before that. When he came to us, he was basically just applying steroids to his eczema. He hasn't really applied any medicine on his high blood pressure and nor his diabetic.
Okay, nice. Thank you.
Thank you.
Yeah.
Thank you, both of you. So the next presenter is Ms. Sang-Lun Astrid, also from China. Her abstract ID, sir, is 431. Sir,
yes.
Are you listening, Dr. Lee? Ms. Sang-Lun Astrid? Yes.
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 You see me?
Yes, ma'am.
Okay. Hello, everybody. My name is Astrid from Hong Kong Association of Homeopathy. Today, I will present a case report of 5th second-degree burn caused by chemical urine. A 3-year-old boy had a 5th second-degree burn on his left arm when he was trying to reach the boiling water. The house helper witnessed and immediately used ice water to cool down patient's left arm. Patient was in great pain. The parent immediately to the patient to the second ward hospital in the car.
Pardon, ma'am, there is some disturbance from your background. Hello.
Hello, can you hear me?
Please speak louder,
Can
ma'am.
you hear me? Hello.
Yes, ma'am. Better, ma'am.
Can you hear me?
Please go on. Yes.
Okay. Okay. As a result, the parent immediately took patient to Canberra Hospital in Macau. And in the hospital, patient was treated with routine daily wood dressing. However, at the first night, the patient was in great pain and itchiness. His palms and front arm went through from the tight wrapping. Examination showed suboptimal perfusion. There was also a peculiar kind of sensitivity to touch, not only the wood, but also the generate over the body. And this is the first day after the injury. And you can see the circumferential injury can be complicated by perfusion insufficiency. This is English case. And one reminder, according to law of similar, we would suggest using warm water instead of using ice water for the first management. It will limit the extent of injury. And there were 21 remedy for injury of burn, according to Boracay Laboratory. Unical urine 200C was prescribed after repetition and differential diagnosis. Prescription is unical urine 200 hourly. And this is the third day of the injury. The next day after using unical urine, the patient can able to play with his toy without pain. After the fourth day using unical urine 200C, the wound has formed a huge cloud. And this is the 7th day after the injury, edema of his arm has subsided. At the same time, a doctor from Canberra suggests to perform early excision and subsequently speed skin sprouting (SSG). He told his parent to make a decision in 2 days. Otherwise, the consequence could be disastrous. Parent at the end denied to perform SSG, since homeopathy can assist patient to recover without any pain. Parent continued to give unical urine 200C to patient. And coming up in the 11 nights after the injury, this is amazing. The new skin is coming up and the scalp came off. And this is the 22nd day of the injury. And the parents noticed that the patient's arms differentiate, the pigment is differentiated from the original pigment. They immediately told patient to expose under the sun to balance the balances of the skin color. We immediately remind them not to do so. Otherwise, the skin color would be even have a big discrepancy. There is no aggravation in the whole healing process. Ultimately, the patient did not perform any surgery, but was fully recovered without scar by using article urine 200C. And this is 4 months after the injury. You can see the skin is totally recovered. Just the color a bit different, but by the time it becomes normal. And actually, article urine is one of the polychecks that are used very commonly in our daily life, especially in superficial burn. It's so that the single remedy prescription by the individualized approach can add well in deeper burns when symptom picture match. Article urine is also commonly used in a case of insect bite, foot allergen, skin rash, rheumatism, and urine access diseases. This case is an acute case. After the patient was burned with hot water, his arms was in great stitching pain, which indicate the pain of article urine, stinking nettle, and itchiness. In addition, this case showed that homeopathy could be a possible alternative to SSG in well-responding patients. SSG in 3 years old can be very complicated because of his growing rate. Revision of surgeon may be needed regularly. Time homeopathic intervention may provide a much favorable outcome, especially in young patients. Thank you for the patient's parents who give and their consent to share their case. According to Monarch criteria for homeopathy, the score is 7 out of 13. As a rough rule of thumb, the acute case 6 and above can be considered to be indicative of a good causality score. This is the end of my presentation. Thank you very much.
Thank you, Dr. Astrid, sir. Any questions for her?
Oh, it's nice, Dr. Astrid, that you had selected article urines on the basis of the totality or whatever. It was individualized for the case at this point of time when you were treating the case, and SSG was done, and it was actually one of the adjuvant remedy for SSG. I think so, because that would have been otherwise not possible to improve the status of the patient. And incidentally, you have used this Monarch, which actually talks about the causality, and this is nice presentation. I must congratulate you. Thank you.
Thank you very much.
Thank you so much, Ms. Astrid. Okay, the next presenter, sir, is Dr. Ankur Desai. His abstract ID is 402.
402. Okay.
402. Topic is the well-dressed gangrene, saving a limb from Dr. Ankur.
Hello.
Yes.
And a warm welcome to all the delegates, panelists, and all the experts. Hanemanian greetings from Vadodara, Gujarat. I am Dr. Ankur Desai with co-author Dr. Jaina Desai, presenting this case, which is a way of paying homage to one of great researchers and a good Dr. from Mumbai, Dr. Prabhakar Shetty. Now, this is his way of treating the gangrenous cases. I have received this particular patient from Dr. Shetty before 15 days of his passing away. Dr. Shetty passed away after giving responsibility of this case to me, and this is a way that I'm paying my homage to him. A female patient in her 60s, she came down with dry gangrene. She was having a bad state of affairs since she was already operated upon once and her gain was growing. She was not having any control over her sugar, and at the very same time, she had started developing a state of affairs where she never wanted to live. So in this particular state, I took her up, did the primary health checkup, hemoglobin very low, with the total count nearing almost 14,500, RBS 300 plus. We started taking her. I continued the prescription of arsenicum album 1M, which was given by Dr. Prabhakar Shetty, TDS, and asked the patient to go for the surgical excision of the gangrenous part. This was done by a local general surgeon. We consulted a physician also. We gave antibiotics along with that. And now came down the moment where I had to intervene and start dressing. Hence the title of well-dressed gangrene. I've done nothing but to dress. The only thing different, no povidone iodine, no local antibiotics, no spirit, no hydrogen peroxide, even not loose cotton, except in cotton gauze we have used nothing. And we started using calendula ointment along with the echinacea mother tincture, which was diluted 1:10 in water. And then we started spraying, cleaning the wound on daily basis. This went on for a long while. In the meantime, after a month or so, the patient developed a localized line where there was evident gangrenous tissues were there, a lot of pus formation was there, and the patient was seemingly not improving. At this particular point, we had to change the antibiotics in consultation with the physician, and she was put on a higher generation oral antibiotics. Let me tell you that she was not given any intravenous antibiotics because the efforts of doing so failed, and she had a bad adverse drug reaction. We continued with arsenicum album 1M and kept on dressing at least 5 times a week. Later on, in the month of January 2021, she started improving and the pus formation was much less. We were happy, but this was not the end, as she developed a chip fracture of the same toe and same leg, I mean to say, and then we were worried that she will develop gangrene again. But fortunately, with the basic management, without giving any other medicines, only with conservative management, the fracture healed in a time, and she started getting the wound clean as well as nicely getting into the healthy granulation tissues. This went on for quite a while, and later on in the month of February, we thought of doing one more testing. Rather, in the month of January only, we thought that we are giving antibiotics and she is taking them for so long. Let us have at least serum creatinine done. Serum creatinine only 1 mg per dl, which is very good for her being hyperglycemic for more than 10 years. We started, continued, and we stopped dressing her in the month of April as corona increased, and we never wanted her to get exposed to any one of us. So we stopped dressing. This is her last photograph, taken only a week before. She's supposed to get her cataract surgery done. Hemoglobin more than 10.1, CRP 5, total count 10,540, COVID test negative. She's supposed to get her surgery done. She's taking insulin Lentus with insulin human mixtard. There are no antibiotics required. There is no relapse, and the photo journey of the same I must share with you all, since this is a different photo journey. So I am trying to share another PowerPoint where we have the complete photo journey, and that will reveal why we are supposed to be giving credit to Dr. Shetty for this method. You can see this, that complete blockage of all the arteries below knee. So she was supposed to be going for angioplasty, stenting, and balloon angioplasty for the both the limbs, but we have avoided that also. We have avoided the recurrence also, and it is almost a year. She's fine, she's doing well. We hope that she will continue being well, and this is how we will be able to do good limb saving exercises with homeopathic local application and judicious use of homeopathy medicines. This needs to be noted down that Dr. Prabhakar Shetty did this for his entire life. His works are published. We should study the works, and we should study the ability of arsenicum album in establishing collaterals, especially improving the local perfusion, because that will be the crux of it, and that will be very important. So this is a case, my way of presenting to the fraternity, that even certain local diseases can be managed with local applications, and we will be able to have a good result. So this is how I conclude myself. Thank you all very much for patient listening, and thank you very much for your time. Thank you, LMHI. Thank you, all the panelists.
Thank you, Dr. Ankur. Sir, Dr. Neeraj.
Dr. Ankur, well done. I would definitely congratulate you on the unique way of presenting this case, which had wonderfully improved under whatever medication, especially arsenic album, which was considered as one of the constitutional possibly. And I appreciate your effort. And Dr. Prabhakar Shetty, whatever you had mentioned, we have not read his literature, but certainly you had given an opportunity to go through his literature now. We will definitely be, I think, benefited with these kind of.
Sir, at this note, I'm sharing those references, certain references in Homeo book. We can find an article by Dr. Prabhakar Shetty, that is diabetic foot gangrene is curable by homeopathy. This is again by Dr. Prabhakar Shetty, and he mentions why arsenicum albums. He is mentioning his methodology, and he was one such person who has shared his cases on different forums, including the 66 LMHI platform also, where he presented at New Delhi, and his presentation was appreciated by one and all. I was one of the witnesses. I took this up because I feel that this is raising a good concern among the lay students who are not well trained into direct constitutional things. Now, if we teach them how to dress, how to get good results from calendula or echinacea or other medicines, they will start building up confidence. One will help. Once we have together, can definitely come down with something. The acronym that I have already used is homeopathic local applications, HLA. We should be favoring them, and observation of homeopath will be the key to this, and we will definitely avoid unnecessary surgeries. That is what I would want to share, sir.
Thank you. Thank you.
Thank you, Dr. Ankur. Sir,
thank you very much. Good day to all of you. Thank you all.
So the next presenter, Dr. Geeta Rani Aroda. ABS ID is 139. Dr. Geeta Rani. Topic is study of 35 cases of eczema treated successfully with homeopathic medicines, a case series.
Good evening, everyone.
Good evening.
Good evening, Dr. Neeraj Gupta.
Good evening.
Yeah. May I share my screen?
Yes, yes. Go ahead.
All right. Since the poster doesn't have the font very clear, I'm sharing the same thing which is on the slides. Will that be okay?
Yes.
So I'm going to share my experience on treating eczema cases. In fact, this particular study which I'm presenting here, along with Dr. Aarti Goel, who's my co-author, who also was working at the clinic during this time all these cases were seen. So what we have done is we have done a retrospective study of all the cases which were coming to the clinic in that particular time zone of 2 to 3 years span. So what we did was we took out all the cases and evaluated that what is actually working and what is not working, to understand the role of homeopathy and to see what works, what doesn't work, so that it becomes a learning for us. And on the basis of that, we can plan a better study. So this is a retrospective study. So as we all know, eczema is a skin condition and it's an inflammatory changes which is seen and it could be due to external or internal factors. And also it is typically presented as redness, swelling, papules, vesicles, scaling, etc. And whenever a case of eczema comes to the clinic or any skin eruption comes to the clinic, it is very important to diagnose it correctly. It is very important that we differentiate it from any other allergy and we differentiate it from other disorders like psoriasis. So a typical eczema case will present with history of itch in skin creases in the folds. It will also, you can see the history of asthma and hay fever. So when I say history of asthma and hay fever, I do not mean the history only in the person, but in the family history also. Dry skin, visible flexure or eczema is very, very common. And usually you do see that eczema many times starts in the first 2 years of life. It might not be in the full-blown eczema, but you see infantile eczema history, you see allergy history, you see sensitivity to wool, etc. And the complications can be where there are severe eczema. They can be bacterial infections, pyogenic cocci, viral infections. When there is itching and you do it, the person does with dirty hands or gets infected, and that can also be seen. So we have taken out this case series of, we have 35 cases which we took, and it is a uni-centered retrospective observational study where all the data was collected from the OPD of the clinic at Heal with Homeopathy, which is in Kalkaji, New Delhi. And the cases were all treated with individualistic homeopathic medicines, and they were administered according to the principles for homeopathy. We did regular follow-ups. The usual follow-up time was 2 weeks, and in some cases, 2 weeks and 4 weeks. And changes were observed and recorded at each follow-up. And also we maintained pictures of all the cases to really see that whether the patient is really getting better or not getting better. So patient's subjective feeling and also our picture records is what we keep as our criteria to say whether the patient has got better or not. So when we, now if we see the gender classification, 15 patients were there who were females and 20 were males. The age group which is there is from 0 to 60 years. So the maximum number of cases fell into the category of 0 to 10 years and 31 to 40 years. As I said, that eczema is many times also seen in the early lifespan. So these were the maximum cases which we saw at the clinic, which came into the study. We also had a lot of dropouts. So out of 35 cases, 21 cases have shown improvement. And when I say improvement, all these cases have had a very long follow-up. That is the thing which actually made us conclude that there is improvement. That even after the treatment was stopped, we tried to keep a follow-up of the cases by checking on them and asking for the pictures to see how is the site of the eczema doing. So 7 cases did not show improvement at all, and 7 cases were dropout. So the percentage is not very high, but still what is getting improved is completely getting improved. And that is something we want to take as a learning, that what is working and what is not working. So correctly chosen remedy with strict homeopathic principles shown maximum results is what we observed. Now, I would just show a few cases, which, for example, this is a case of weeping eczema, which was a case of weeping eczema for a very, very long-standing time. He had been using steroids and oral medication, anti-allergics for a very long time, and he did not just have eczema, but he also had hay fever. So constant sneezing, allergic rhinitis during every change of season. So you can see a very severe case. So this is what happened after a few months of treatment. The betterment started coming in. These are all the records which we maintain in the clinic, if you can see. And this patient was on a very frequent doses of medication. This particular case is of that of natrum silicata as a constitutional remedy. And this is if you see this follow-up Jan 2014 and May 2014, in between this time, he's barely received 3 doses of 1M when he was on. And then again, after a year, we asked the patient to come and show us that whether the case is still, if there is any recurrence. So there was no recurrence. And then during this entire 1 year, he was again given a repetition of a dose only at the change of season, just few doses. So in fact, when the patient now comes with his child, the child also has bronchitis, who's also improved. So then also we just ask and take the pictures only for a record to see that whether the case is really improved or not. And so this is I'm just showing the cases very briefly because you're not going to get into the details. We have to understand what was this retrospective study teaches us. This is another case of weeping eczema, which was not a very old case. The patient had this complaint only for about a year or two, was using corticosteroids local application, no oral medication, no other complaints. He had eczema only on one right hand. So it was very embarrassing for him. And but he was treated with a homeopathic remedy. The first remedy did not work, so he was given a totality-based remedy. The first evaluation was most likely not correct, and he was treated by pulsatilla, and he never had the eczema ever again. So I feel only when we can stop the recurrence and we can stop the occurrence of the disease again is what we should call as improvement or a cure. And this is another case of a child who improved within few months of treatment, if you can see this. And so see, now the child gets the recurrence again after 2 years. There could be any reasons why this child has got it again, but again with the same. Yeah.
Sorry to interrupt. You are running short of time. Only
Okay. I'm doing it. Okay, I'm taking
please
it.
wrap up. Hurriedly.
Yeah. So he improved. Then again, so similarly, if you see, so what I would like to conclude is that the study shows that homeopathic medicines were very useful in the treatment of eczema. Medicines which were given on the basis of symptom totality were found to be effective. Most commonly used medicines were natramune, calcarea carb, calcarea 4 silicia. Totality-based medicine were found to be useful in decreasing the lesion severity and preventing the flare-ups from the otherwise triggering factors. And skin-specific medicines gave a temporary relief and needed to be followed up by a totality-based medicines. And so basically totality-based medicine were giving the main results. So I would like to thank all the patients for all the patients they had with us, the staff at our clinic, and also the learning which we have done from this retrospective study is that we now are going to not only do the picture as a follow-up records, but also planning to use scales which are suggested for eczema. For example, a POEM scale, which is patient-oriented eczema measure. So that's what I would like to say. And if the time is over, then I'd like to conclude it here.
Yeah, thank you, Dr. Geeta, for a wonderful presentation of 35 cases, whatever you have taken. The carry-home message is that unless or until we select a remedy on the totality, which would be a constitutional, so we may not be able to cure the cases. So this is what we had to understand. And very importantly, that in these cases, when there is an obstacle, when the cases are not going to go further, we need to think of some intercurrent miasmatic remedies as well. So that we have to consider, and very well said that we have to use some scales, as we have mentioned about POEM scale, because that is the need of the time, that unless or until we have some evidence through some scales, questionnaires, or standardized scales, so we may not be able to justify in the scientific community. Thank you very much.
Absolutely. Yes, sir. And I completely agree with the use of intercurrent. I have used in cases wherever it was required, where I got stuck and the case was not improving. So I completely agree with that input.
Yeah.
Yes.
Good. Thank you.
Thank you so much.
Thank you, Dr. Geeta. Okay, sir. The next presenter is Dr. Neha Jayadrat Patel. Her ID is 285. Abstract ID 285. Dr. Neha.
Yes, ma'am.
Okay. You can start your presentation.
Okay, ma'am. Thank you. Everyone can able to see my screen?
Yeah, but you have to share your poster.
Is it okay? Is it not yet shared? Yes, just a minute. Okay, now is it visible?
Not yet. Yes, yes.
Is it?
Can you zoom in a little? The font is very small.
Yes, ma'am. Is it okay, ma'am?
Better. Yes.
Okay. Okay. Hello, everyone. First of all, I am thankful to all LMHI members for giving me opportunity to present my work. My topic is usefulness of homeopathy in treatment of atopic dermatitis with psychological causes. As we all know, atopic dermatitis is a chronic inflammatory disorder of the skin. It can caused by combination of immune system activation, genetics, environment triggers, and stress. Several studies have shown that patients of atopic dermatitis react differently to stress and experience worsening of skin symptoms after exposure to stress. This is because cortisol hormone release after stress stimulating immune system and causes inflammatory response and ultimately result in pruritus. Thus, stress is the triggering factor for atopic dermatitis, and if we understand the cause of the stress, we can learn how to manage it. So, homeopathy can help here. There are many ways of prescribing the medicine in homeopathy. The most scientific way of prescription is giving medicine on the basis of individualization. And this individualization can be ascertained by many ways, and one of the way is to find out the cause and its effect on the individual person. So here my main objective of the study is to understand the psychological cause in triggering atopic dermatitis, and another objective how to reduce it with the help of the medicine. Here I have chosen 5 cases of atopic dermatitis which were only be treated by homeopathic medicine, no any other medication in the form of the lotion or anything not applied to that. Uh, Major systemic disorders with dermatitis were excluded from the study. Detailed case taking was done, data collected from patient as well as from patient's relatives regarding their mental and physical complaint. Totality of symptoms were formed on the basis of mental general and physical general with physical particulars. All cases were repertorized, and from group of medicine, the final medicine was selected on the basis of mental general or psychological trigger factor and its effect. Data analysis done by the data analysis done by the pre-treatment score and post-treatment score according to EASI, that is Eczema Area and Severity Index. Results were analyzed after 3 months of the treatment. Total 5 cases are taken into consideration, of which 4 cases are of female patient and 1 case is of male patient, all falling under the age group of 35 to 55 years. Now I'm going to give brief idea about my all 5 cases. The first case that was of female patient of age 42 years and having constant anxiety about her future, as she has some difficulty, or her visa paused during this COVID condition. So at that time, there is a constant pressure over her that she is always anxiety what occur in future and how I can settle down in the abroad. So that was taking along with the other mental and physical general symptoms. We taking this stress in under the consideration, and we prescribe graphitis to her. And her pre-treatment score was 12 before the starting of the treatment. That was become 0 after the end of the study. So here we get a significant improvement. In second case of a 37-year-old female patient who was divorced due to some marital conflicts with her in-laws and her husband. And during the interrogation, she gave strong feeling of disappointment of love. So on the basis of that, natrum mur was chosen and it was prescribed to her, and her pre-treatment score was 11, which was become 2 after the 3 months of duration. So here also we can say that we get a significant improvement. In third case of a 51-year-old lady, she has a past history of here that she was advised for abortion from his gynecologist, as there may be 50% chances of mentally retarded child. She denied for that at that time, as it was a first pregnancy for her, and she gave birth, but unfortunately the child was a female mentally retarded child. After some time she came to know. So now she is regretting very much over her decision. So here her weeping disposition with long lasting grief was considering, and along with the other mental and physical general symptoms, natrum mur was prescribed, and her pre-treatment score was 11, which was reduced up to 2 now. The fourth case, the fourth case is of 40 years old female. After thorough case taking in interviewing her in-laws as well as her parents, we figure out that the patient has a feeling of offended always, and she has a vindictive type of nature, as she always wants to give back to the persons. So with the other physical general and particular symptoms, nitric acid was selected for her and it was prescribed to her. And after that, her post-treatment score become 5, which was 14 before. The fifth case, it is of a 41-year-old male patient. After thorough interview of the patient, we conclude that the patient had feeling of being insulted many times and he can't express his feeling. So there is a suppression of anger, and considering these mental and general symptoms with other symptoms, we choose Staphy's agria here, and his score becomes 7 from 16 after the end of the study. So at last, I am concluding here that present case series emphasizes the rapidity of the response in terms of the moderate to significant improvement in the patient. Homeopathic treatment become beneficial here when other conventional medical options have been unable to relieve or shorten the disease. Thank you very much for listening me carefully.
Thank you, Dr. Neha. Sir, any questions?
Yeah, Dr. Neha, nice presentation. One thing I would like to add that these kind of psychosomatic disorders, or what you have taken as atopic dermatitis, as such, requires psychological, evaluation. So your topic is absolutely good that you have taken individualization, cause and effect. Under cause, you have taken the psychological domain, which definitely would need the patient to be understood properly from homeopathic point of view. So congratulations. Thank you.
Thank you, sir. Thank you very much.
Thank you, sir. The next, there's one more presenter, sir. Dr. Manjula Guliani. Her abstract ID is 364. Dr. Manjula Guliani from Delhi. The topic is role of diagnostic assays and homeopathy in containment of COVID-19. Dr. Manjula.
Ma'am, they are checking. They'll be telling us within 1 to 2 minutes.
Okay. I think I'm able to do it. Yeah, I think. Is it okay now? Is it visible?
Yes,
yes. Ma'am, it is visible. You can enlarge it.
Thank you.
Zoom it a little. Yeah. Okay.
Good really sorry for the disturbance. Good evening, everyone. My topic is role of diagnostic assay and homeopathy in containment of COVID-19. Am I audible?
Yes, yes, you can go on.
It's actually due to spread of novel coronavirus globally, which led to quarantine millions of people and caused thousands of deaths and huge loss of economy, posing great challenge for global health system. So, in this, I just wanted to do little for the containment of COVID-19, and in this review, mentioned the new norms developed and few homeopathic remedies identified as prophylactic or therapeutic to contain the spread of coronavirus, the summarized in this, and a little what I'm a little able to do to contribute a little in containment of COVID-19. Firstly, all the cases, firstly, the confirmation of cases with suspected SARS-CoV-2 infection was performed with highly sensitive and specific diagnostic assay RT-PCR by using sterile nasopharyngeal and oropharyngeal swab. And rapid antigen test also was performed for qualitative detection of N coronavirus antigen in human on the principle of immune chromatography using sterile nasopharyngeal swab. So generally, all the patients, whoever reached the center, they all were first tested for RAT and RT-PCR both. And these assays, on the basis of these reports, we were able to give homeopathic medicines and evaluate them. So these assays are key to identification of cases, contact tracing, prevention, and control of COVID-19. So, on the basis of this report, a very massive level contact tracing was done, so that none of the contact is left for so that infection can be this coronavirus can be contained, so that none of the contact comes in contact to the other persons. So secondly, after this evaluation or diagnostic assay, homeopathic participated in the study, homeopathic remedy participated in the study to identify the homeopathic remedies for COVID-19 symptoms. So, which was under the topic homeopathic remedies in COVID-19 prognostic factor research to identify homeopathic remedies based on symptomatology of COVID-19. And the data was collected from COVID-19 Health Clinic. An LR ratio was calculated for each symptom for prescribing indicated homeopathic remedy with highest LR value. And thirdly, as an investigator, performed a study of 750 cases to evaluate efficacy of selected homeopathic medicines in prevention of COVID-19 through double-blind trial. And in this, I found in this actually the tests which were done. Firstly, the tests which were done, they were approximately 550,000 each. RT-PCR and RAT tests were done till uh, November 2021. They were performed by that date. And while performing diagnostic assays, negative results could be seen in infected individuals due to several factors such as poor quality of specimen, sample collected at an inappropriate day of exposure. If a person is exposed, they're supposed to take sample on 1st, 5th, and 7th, and then 14th day. So if by chance a person gets tested on 3rd day of exposure and a 6th day of exposure, and that gives an inappropriate result. The data from study reveal that arsenic album, Bryony alba, gelsemium, and pulsatilla nigrans are 4 most indicated homeopathic remedies for COVID-19. And for double-blind trial, approximately 750 cases were under double-blind trial, and only 41 became positive, and that too in the second wave. That double-blind trial was almost finished by that time, and then after that only those 41 persons were found to be positive. So in the end, the conclusion is when performing these assays, proper gentle rotation of swab at posterior nasopharynx is required. Otherwise, it gives a negative result during diagnostic assays. And diagnostic assays are helpful to homeopaths in rational decision, differential diagnosis, and effective treatment to contain COVID-19. Because all the fevers, they were considered to be COVID-19, but still, diagnostic assay, they they give the clue about the CT value also, so that what appropriate action can we take, and at what level is the infection is. The current ongoing researches are essential in order to contain the outbreak of COVID-19, and homeopathic medicines helpful in treatment of COVID-19 act as prophylactic medicine, which is safe, simple, and easy to use. Thank you.
Thank you, Dr. Manjula. Sir, you.
Yes. So, Dr. Manjula, it was a nice thing that you had been participating in such a wide spectrum diagnostic assays. As a medical officer, you had a great role of not only supervising, but you were part of this research, and you were able to do something like it is very much motivating that in this second wave, when you were talking about the data, 41 cases after selecting the PFR, that is prognostic factor research ratio. So you were able to select the remedies, and you had given possibly to the patients, COVID positive patients, and only 41 out of 750 became positive in the second wave. So that is very nice. Outcome. So this way, homeopathy has a great role. Hahnemann has already mentioned about these epidemics and pandemics at that point of time. Belladonna 200, he had mentioned as one of the remedy for scarlet fever. And not only Hahnemann, but later on, many stalwarts had used these kind of prophylaxis. And what you studied was something, it is two ways. One is the diagnostic assays, use of diagnostic assays, and second, prognostic factor research. So this is a wonderful experience. So I must appreciate your effort. Thank you very much. No more questions. Yeah.
Thank you, Dr. Manjula. Sir, that was the last presenter. Please say a few words on today's session. So that can
I think I have already spoken with every participant. I don't think there is any need, because already the time is over. So I conclude that this session was very nice, despite some technical glitches with some of the presenters. Anyway, so Dr. Shirin has taken up very nice as a moderator. She had been with us in Nehru College, I understand.
Yes,
and every speaker has done to best of his or her level. I congratulate everyone. Thank you.
Sir, on behalf of the LMHI team, we are very grateful to you also, sir.
Oh, thank you.
Coming in as the chair at a very short notice. Thank you, sir.
It's my privilege. Thank you so much.
Thank you, Dr. Shireen. Thank you, Dr. Gupta.
Okay, bye-bye.